Well, isn't this a great week already? How many got pizza today? And again, what I'm trying to do is get a little comfortable with the red light. And so those who will get up here and say a few things, that red light is so intimidating. And no matter, you can barely see it, but when you look back there, you look at it. So I'm doing this because it is a little nervy. And where's Heather? So she's getting some coffee on board, make it a little better. And so she'll be relaxed time she gets up. But anyway, is Rohan in here? He's probably getting all the dough and the flour off. Will he be in here today? So again, I want to thank him. Today was trying to feed everyone pizzas. And anytime high performers begin to try to deliver or attempt to deliver, you learn a lot. You learn about your challenges, those opportunities. You learn when you had the greatest impact of your work, but also you realize some also opportunities and some gaps. So he learned real quick today that, hey, he wanted every employee to have hot, delivered, experience-based pizza. And how many pizzas did we have? How many total do we have pizzas made?
224.
So 224, but also to get all that done in the time he needed, to kick off at 11, he realized he probably needed to start at 9. But yet that first group may not have got that hot pizza. And so I know he's probably beat himself up some, and that's okay. Sometimes we all beat ourselves up some, but he was wanting the best. So when he comes in, you know his body language. I mean, he's had such an influence on me. I wear happy socks almost every day. And if I'm down with Jennifer and she's taking care of an ED, she may have a bad day or an experience. And I'm going to say, Jennifer, bring it on. You know, bring it on. We're all going to have those type days. I do, you do. But we're a part of a team. But what was cool about it was I saw many of the managers, people come down to say, hey, how can I help? But here was the special one. One of the housekeepers was up on the 3rd floor, and I said, have you got your pizza yet? And they go, no, but I know that I'll get mine as soon as they get it ready. I thought that was pretty special. But then I was in another area, and they were like, yeah, they're late. I was like, yeah, they're late. Yeah, and again, that happens sometimes. But I think high performers, they show up despite the challenges. They're always looking for another opportunity for the next right answer. Low performers don't. They don't show up that way. They show up in that real below the line way, so to speak. So again, I want to thank all of you. I know, Deborah, you had flour all over you. And I want to how many else went out to get pizzas? So I know a few of you went out driving to get pizza. Cynthia, I know some of you others did. So thank you. I just want to say thank you. That was something that we'll go back and debrief. And Brian, I know, great job from that perspective. So again, we'll get started now. I think I got through my little jibber jabbers. But series number 7. And then about every quarter, I want to bring the team together. And again, when Betsy brought this to me, realizing that the dietary department, they really wanted to wait to open all at once. Well, I'm like, no big deal. We don't have to do it that way. We'll just open it like you had planned. But again, it was not all about me. I know how that is to go into an operation. You want it to be just right. But again, they're going to have it just right for each of you. And so I want to say thank you again to them. Again, series number 7. I thought I saw Mark. Is Mark still in here? So Mark, I want to say thank you. I know this will be your last Employee Connections. I want to say thank you for your labor of love for the foundation, for the community, and on behalf of the organization, the board, and each one of us, you will not be forgotten, and you'll always be a friend to the organization, and we thank you for your love and all the work you've done. Can we give him a hand? Do we have any other folks that are retiring or transitioning? Okay, Tina. And again, Tina, I want to say thank you to you. And Tina's going to be transitioning. She's not going too far. She's going right up to Road Oconee Medical Center. And I'm excited. I know Hunter. I talked to him this week. He's very excited. I started telling him all kind of fibs. And he's like, what? And I said, no, you're getting, I said, from my perspective, and I'm sure that Brian and Joan, they're getting someone's a high performer, someone that's committed. I said, you're going to get a workhorse. And I said, she's been through so many different things here in the lab, and they're excited about having you to include the entire system. So yet you're leaving us here, but you're still part of the family, and we'll all see you again soon. I promise you. And so I want to say thank you for your service, 15 years now? And I'd like to give her a hand for her service. You know, I think that's a part of community-based health care. And again, I said this at one of our LDRs, I think it was about 2 quarters ago. There'll be many people, as leaders, we are to be in constant move of preparing for the future. And so when one job opens for one, an opportunity like existed up in Oconee will be a potential opportunity for someone else. Also for folks that are wanting to transition. We have folks that are highly educated here. Probably some of the best I've seen in my healthcare career of folks that continue to advance themselves both academically and through work. When those things happen, I want you to feel good about coming to us. Some may not. But you have an open door to me, to the team, all of us, that if you're wanting to advance, feel good about it. Then I always say, if you don't get that opportunity, you've had a great experience. I know what it's like to interview for 2 or 3 jobs and not get them. That doesn't feel good. But yet you still have the opportunity for a job you currently exist in. So just remember that, because we all looking for transition, how we better ourselves. And if it betters you, Tina, it helps us, for all of us. And that's my message to you. If it benefits you, it benefits us, because we're a family, okay? Here's our agenda today. We'll have a quick devotion, again, a connect to purpose, mission, vision, values, our areas of focus. We'll talk about that, really how we focus on really primarily 2 we'll talk about this time. Second quarter results. I think you'll see some shifts over last quarter. Our current project, we'll give some updates there, award and recognitions. Series 6, we did a survey last time, and we'll share those results. We'll actually answer a few questions that you all gave and our employees gave. Again, the agenda looks about the same. Just like you'll see in LDRs, you'll see very consistent messaging. You should see this messaging in your departments as you give education to your team, so we're all on the same page. Again, aid it. Again, we are not hardwired. I hope the message will be back to the employees when you share this. Begin to ask questions about aid it. Again, our student coach here was last quarter. She'll be here, I believe, this week. And one of the things that consistently, the message that she says to me, to each of you that she's coaching, is that, Mike, you guys can move quick, but yet you have a difficult time sustaining the gains. So again, I believe AIDIT is at the forefront of that. Each time, every time, all the time. And I think some of you do it better than others. I mean, we've got some best practice. I mean, Sherry, your team, again, another best practice. There's others that have best practice here. And so I know our physician enterprise, when you see their results, second quarter, they're still achieving their goals. I know AIDIT is a great part of the physician enterprise work. So again, I think we have it in pockets, but it's each time, every time. That should be your expectation. That's my expectation. It should be yours. If it's not, then we need to have a conversation, because the employees need to understand it's an expectation. But make it your own. It's a different experience. It's a different patient. It's a different encounter. It's a different time. Make it your own. And our employees should make it their own. Again, bring it back to evidence, just like we do in clinical evidence, evidence-based leadership principles. Again, when you acknowledge a patient, increases safety. Again, when you introduce yourself, begins to increase that trust. You know, when you talk about duration, decreases anxiety. Explanation, it increases compliance. Can anybody give an example of how explanation increases compliance? Okay, everybody hear that? So another great example. So be able to articulate examples around this acronym called EDIT. Then lastly, thank you. It increases loyalty. I mean, we want our community, we want our employees, we want our families of our employees to really see us as brand identity and to be loyal to each other. I think you'll see throughout the presentation today is how do we become loyal together? We saw it earlier this morning looking at our claims up to this point. It was remarkable to see that how much our community, our covered lives, how they begin to move within the healthcare system. Both here, all the tier 1s as well as the tier 2s, even if they're paying for it out of their pocket. that was unique to me, Dr. Helmrich, is how many employees use level 2 health experience, like a St. Francis, like a, you can fill in the blank, but yet they're willing to pay for it out of their pocket. That says a lot to me. And so we need to really tease that one out a little further. But again, increase that loyalty. I'm going to now hand it off to Dr. Coleman.
For those of you who may be new here, I am Walter Coleman. I've been the chaplain here for 15 years, and for many of you, I already know. Some of you are new to this organization, but I do appreciate it. This afternoon, I want to focus on one particular idea, and that idea is that of appreciation. And I want to begin by a 10-word question that is asked by Paul to the Romans when he says, "If God is for us, who can be against us?" And this is an undeniable and unconditional appreciation for our worth as human beings. God has said that He unconditionally accepts us, and when we come into this world, that is the foundation out of which we come into the world as human beings. And there's no question about the fact that our worth is sealed in the way in which He sends us into the world. Appreciation is about who we are as persons. And when we're talking about rewards is what we do. But the Bible always focuses on being first and doing second. So we're talking about appreciation. And a way of expressing that is found in a writing by Gary Chapman. He's written a book called 5 Languages of Appreciation in the Workplace, and he provides a 5-fold model and the way in which we express appreciation one to the other. And the first one is by words of affirmation. Notice that what he's focusing on here is the character of an individual. Focus on perseverance and kindness and honesty and integrity and patience and love and unselfishness. That's a way of saying, I appreciate who you are, and I appreciate the character that you have and the way in which you carry yourself and carry out your work. So all of those are focusing again on the person. In the second way, quality time. Sometimes we just need a person to have a listening ear. Sometimes we need a person to just simply be with us, and we know when a person says, I will be there for you. We know when that happens. We know that those persons give us their time, they give us listening, and they listen deeply. They ask questions, and they give you feedback back and forth. That's another way of expressing appreciation for an individual. The third one is acts of service. Sometimes, anybody in here ever get overwhelmed? I think everybody can express that. And sometimes the best way that you can say, I really value you, is when you go to a person, you say, could you give me a hand? And they give you a hand. That's a way in which they can say to you, I really appreciate you and I value you. And that act of service can mean so much at the right time. The fourth one is a tangible gift. Sometimes we know our people so well, we can say, I really just want you to know how much I appreciate you and your family. So I know that you like movies, or I know you like a certain place to go out to eat. And I want to give you a card. And I want to give you some way to say, this is how much I appreciate you and this is how much I value you. So you do those kind of things and you share those things as a way of expressing appreciation. The final one is a physical touch. A pat on the back, a high five, a handshake, a squeeze on the shoulder, a hug. Those are all ways of saying to an individual, I know who you are. You're a friend of mine. I value you. I value what you do. And sometimes you don't even have to say a word. As the picture indicates, just by somebody coming up to you and squeezing you on the shoulder, that's just a way of saying, I know who you are and I value who you are. Now, the thing that's a trick here is taking those 5 and knowing how to express appreciation to an individual. You need for a person to feel like they've been appreciated, they need to have the way in which they can receive that. So that's why there's the 5 different ways of doing it. Not everybody's going to receive it in words of affirmation or a tangible gift or a physical touch. Sometimes it's the quality time or the act of service. You need to know that and be able to express it in a way that a person can receive it. So determining that is a vital part of what we do in expressing appreciation. Would you bow with me for a prayer? God, we thank you for your affirmation. We thank you for accepting us unconditionally and loving us, and out of that, to be able to express appreciation one to another. Be with us now, we ask. In Christ's name, amen. Now I hand this off to Betsy.
Thank you, Walter. What an honor it is. For those of you that I don't know, I am Betsy Beam, I am your Chief of Staff, and part of what I get to do after I've actually been here this month is my 9th year. So part of what I get to do is, as patient compliments come in, we record those. We make sure that the staff is rewarded appropriately. We'll talk a little bit later on about some reward and recognitions. But basically what I'm going to do today, rather than read a letter or an email, is when we were thinking about appreciation, I started looking at some of the samples that we had, and one of the commercials or videos that was done for us a couple months ago seemed to hit most on appreciation. So I am going to let Richard, for about the next 2.5, maybe 3 minutes, tell his story. He was a patient in a wound center. Basically, so you'll know, all I'm doing is going directly to our website, www.baptisteasley.org, and clicking on that commercial. And like I say, I'm going to let Richard tell his story because I think it really talks much more about appreciation. So let me turn that on for you.
I was real surprised that the hyperbaric chamber actually worked and healed my back to the point where I can get out and do things. I was at Duke and they did a CAT scan on me, and the cancer had wrapped around my spine in the middle. It actually grew the wrong way. They expected it to go that way, but it went that way and it wrapped around my spine. And they said that if I didn't have emergency surgery and get the cancer out of my spine immediately, I'd be paralyzed in 2 to 3 weeks. They split my back from my neck all the way down to the bottom of my waist. They sewed me up. I did good. The back was starting to heal, and they decided they wanted to do some radiation on my spine. And on the 10th treatment of the radiation, my back just split back open, and everything around my spine died. Skin, the muscle, everything. The doctors at Duke actually gave up on me because they couldn't understand why it wouldn't heal. They knew that the radiation killed everything and that it was a mistake to do it. But they couldn't figure out what to do. So my family doctor sent me over to Baptist Easley to the wound center because my back wouldn't heal back up. It wouldn't close. Dr. Wheeler gave me a chance to try something different. He took a personal interest in me because he says, I'm not gonna let your back not heal up. That's when he decided that I needed to go in a hyperbaric chamber. I did 59 treatments in it, and it actually closed my back up, made the fat and the muscle around my spine grow back. The back quit leaking, and actually all my vital signs came back to normal. My back is not completely healed, but it's so close to being healed that I can walk around and do things, do normal things now, take a shower, go buy groceries, take care of my grandkids. I pick them up from school every day, and I'm back to basically being myself. Whereas 6 months ago, they wasn't even sure I was gonna live through it. But Dr. Wheeler took a personal interest in me, and I guess he does that with all the patients.
Again, no better words than those of our patients and certainly of Richard. And if you think about it, certainly the ultimate appreciation when one of our patients can say, I can now do normal things like take a shower and pick up my grandkids. So thank you for what you do.
You know, again, being National Healthcare Week, I think about how many times that we work beside different people, different days of the week. You know, I think about our nurses on the unit who are working, you know, maybe 412s, and they come off and they're exposed back to the next rotation, Marianne, and they're working maybe with someone different. Maybe it's a new grad that's being mentored. Then I think about new people coming into the organization, folks that have been here a while transitioning. Tina, I think we ought to remind ourselves that we have so much to be thankful for. And so what I'm going to ask you to do, look to your right. So when you ask your employees this week, and for Brian Finley, you don't have anybody to your right or left. But if you have someone to your right, but you don't to your left, you get the message here. I'd like for you to look over and just tell someone thank you, because we have so much to be thankful for. Thank you. Thank you. I really appreciate you with all my heart. I really mean that. Yeah. Well, as you can see, just like many of you, you want to have that engagement and conversation. But again, I would challenge you to spend more time thinking about what you do have rather than what you don't have. Because today, that same person sitting to your right may not be here tomorrow. And I'm always reminded of that, whether it's through work or life. But we spend more time focusing on ourselves sometimes than we do others. So remember that in this journey. It's about everybody else. It's not about us. And I thought about Richard. What a great story. What a great story. Now, Rohan just walked in. So, Rohan, just a few moments ago, this is being taped. And so those will hear this when they go through the employee connections, that we wanted to say thank you for making the day possible with getting the pizzas out to us. We realized that you wanted to make each experience the best, and you did, and I want to say thank you. Thank you for all those involved. But again, we wanted to say thank you. We know that was a task at hand, and again, I want to say thank you. We appreciate you very much. Thank you. Yeah, thank you. When you think about our mission, vision, values, I think it's important to reflect back, to always connect back to mission, vision, values. No matter where you go. So, Tina, I'm going to use you as an example all day. So you think about the mission, vision, values that we're working on here at Baptist Easley. You think about the mission, vision, values that you're getting ready to go work on. You'll see they do have some connection. There'll be connection. And as over the next few months, we'll go through strategic planning work. Many of you will be involved. Many of our doctors, many of our providers. It'll probably be 3 or 4 months of very tough work. We'll go through the mission, vision, values again. We'll go through every service line again. We'll look at it deep, all the way through the organization, in registration, HIM. You name every department, every service will be looked at and reviewed based on the future. And so when you think about that, I would ask each one of you to begin to think about our mission and our vision and our values. And think about how they exist today. What are we doing as a group? Because you're the movers and shakers of the organization. It takes your leadership to deliver the message that we're going to achieve mission, vision, values. If we don't, we all own it together. It's our job to make sure that's articulate and it's clear. So those preserve, promote, enhance the health of those we serve. We know our vision is to become the healthcare provider of choice. How do we show up each and every day? Also the story of Richard, it doesn't just go on with Richard. There's also another patient, I won't use the patient's name because of confidentiality, that's actually having an experience in the wound center right now. This gentleman has yet to get to the hyperbaric because he's too sick. His outcome globally is terminal. It's terminal. But his quality of life, his family wants for him for the future, the wound center is going to mean a lot to him. You think about strategy. So think about that from that patient experience side. So they want an experience that really takes him, that keeps him well till he is unable to go any further. But think about it from the perspective of an organization around strategy. Why do we do what we do? How does the wound center impact mission? How does it impact our vision? Because that same story, because of Richard, that other family heard about the wound center because of Richard. It's more than just the wound center. It's about that relationship. But because of his word of mouth, they heard more about the wound center than they wanted to experience it because they heard about his back. They heard about his wound. So is that not strategy? Is that not development? Is that not sustainability? Is that not vision? Yes, it is. And we all have to be able to connect those dots for our employees, each and every one of us. Our values. When you think about integrity and compassion and excellence and dignity and teamwork, think about the teamwork it takes to make that happen with Joyce and the team in the wound center. It takes a lot of teamwork. Talked to Dr. Wheeler this morning, and he said, you know what? It is all about teamwork. He has his role, the nurse has her role, and you just can go on and on and on. Teamwork together. Conversation with Deborah today, teamwork. Talking about an employee, change, teamwork. Without teamwork, that was not possible. So again, teamwork is a great part of our work. That's one of our values. When you think about our priorities for this year, we're going to focus on just two. You can read all those, but really number 1 and number 3. I'm going to ask this group to really think about how are you engaging, how are you showing up each and every day. So the employees are going to see this next week. How are the employees showing up to ensure that we include our medical staff, our providers, our employed docs, our non-employed physicians? We want to make sure that we are connecting our providers with us, not after the fact. I mean, I'm guilty of it. Sometimes we will make decisions, then we'll realize, did we engage the medical staff? There are many times that some of you will engage in activity, and then you'll come back and say, hey, I forgot to include maybe you or you or you. It's not intentional, it's a journey. But we need to make sure that we're really being intentional about including our physicians, because we're going to continue to become an organization that truly is not only provider-led, but also our physicians taking up that torch, so to speak, taking up that gauntlet and go. Dr. Helmrich, today I've shared this with most of you. In the absence, if I'm incapacitated or if I am terminated, Dr. Helmrich and a succession planning, Dr. Helmrich's name is listed to pick up the slack and go. Now, you can't get any more physician-led than that. Well, that's pretty close, I'll put it that way. So together, we're running parallel together, but I can't be at every place George is at. He can't be at every place that I'm at, but we're talking, we're communicating, and so forth. Same thing with Brian and Betsy and Kathleen and my team, just like their team and your team. All one team. Number 3, we're getting ready to go through, we went through phase 1. We're going to continue to look at how do we engage our employees and how we transform the experience with each and every employee. We're all employees together. But how do we make sure our employee experience is top-notch? How do we make sure the patient experience is top-notch? So there was a team, about 5 or 6 of us, who did a first kind of a journey to do a 24-hour immersion. And the employees are going to see this in the video, and that's why I'm trying to talk in kind of a little bit further out so they can understand by the time they get through the next quarter, we will have completed this second phase of work. So we have a team that got together. We went out and spent a 24 hours looking at the experience economy. Now the 4 or 5 that went, any 4 or 5 of you could have went to be a part of that, but these were the 4 or 5 people that were selected on the first part. Again, the second phase of that, we've chosen that group, and we've added and we've moved people around differently in the next phase. But the next group will be a group of 12 that we will begin to look at as an organization. What will the next phase of that group be around the patient and employee experience? We will look at things about our mission and our vision. We'll look at how we do policies. We'll look at every aspect of the organization, and hopefully we'll come up with a document that we'll come back in draft with and pick the next 12, 25, 30, 40 people to begin to think about who are we missing in the next phase. And over the next year, we will take the entire organization, every manager, every leader, every physician, every contract, laborer, vendor, whatever you want to call that, and we will go through a full onboarding and transformation experience. I think it will be the delivery, a part of our work for the future that will forever change how we deliver the care we provide here, how we hire the people we bring in for the future. With the state of South Carolina and the upstate, this 11, 12 county called Upstate Alliance, there's a lot of health care. Ranges from Cherokee County all the way to Pickens County, all the way down to Greenville County, and so forth in this upstate area. There is a lot of health care being provided. So the folks that really, the teams that really, the leaders that really, the boards that really get engaged, get active, and really develop the experience, I believe, just like many of you believe, will be the winners for the future. 2016, 30% of our reimbursements will be tied to experience, patient experience. Are we ready? The results we'll share today, we're not hitting those marks. So I believe it's time, just like Palmetto Health. They've realized that for the future they must onboard 8,000 people around the experience. So we'll come back, we'll share more information, but again, we're going to spend a lot of time this year in the development of our team, in the delivery of that patient and employee experience. So I'm excited about it. I know you will be too as well. And then those two areas we're really going to drive focus on. But again, all of those for the number 6 is the real kicker, is that we're going to take every measure with you to ensure financial sustainability. But we're going to do that together. If we succeed together. If we fail together. And I don't believe failure is in this group's DNA, and we will succeed. When you think about Walter, again, I want to thank you for, you really set the tone. And so recently, we work on having a theme for every employee connection. And we're very intentional about it. So this time we had some change, and it shows you about flexibility of our chaplain. He had already prepared. He had really done a lot of great work. And then I said, oh, by the way. And then he was like, he took a deep breath, and then he said, I got it. So he shifted, and I'll use his example. So therefore, if you think about a pseudo team, Walter could have stated, I know he didn't, but he could have stated, you know what, we already talked about this last quarter. We talked about a theme. I actually shared this group. We were going to talk about it. Anybody realize what this quarter we're going to talk about? Anybody remember? See if anybody remembers. It may not even matter. Anybody remember? That of diversity. Remember that conversation? But it would be easy, as Walter and I and Betsy planned these employee connections, he could have said to me, you know what, I've prepared, I've got it done, and that he's entitled to do that. But he did not. He said, tell me what you need. I said, I want us to really think about how do we become more thankful, to include me, rather than being entitled. So when you think about a pseudo team, a team that's, anybody know what pseudo means? False. Again, that gets better every time. Let me ask another question. How many believe in your departments today, based on your audits, that you can go pull the audits and review them, that it's hardwired? Okay, raise your hands if you will. Just get them up. Get them up. Okay, everybody just turn around. It's not, we're all the same family. About 20% of the leaders here, you're all leaders. 20%, 25%, it's hardwired, and you have audits to prove it. And we wonder why we're not hardwired. We got a lot going. So we could all say, hey, we're entitled to the fact that, guess what? As a CEO, I'm entitled to the fact that I expect those audits to come into me every time, and I want to see where you're at. No, I'm just grateful for those who have accomplished that. But when we get the other part that accomplishes that, I believe it will change that experience. Think about entitlement. Why not be thankful? You know, why? It's easy for me as a leader, as an individual, as a dad, as a father, as now as a grandpa, to think that I'm entitled to everything in my life because I fit one of those categories. Now, my wife reminds me that's not the case. But it would be easy for me to think that because I am the husband of my wife, that I can expect a lot of things from her. But I can tell you one thing, I'm so grateful for my wife. I'm grateful for each one of you. We are working in probably the toughest industry in this world. I guarantee you. Well, at least in this country. Very tough environment. Wouldn't y'all agree? So we can either think we're entitled to everything and things just happen to us, or we can be grateful and appreciative of what we do have, and then we move from there. That's the shift that I want us to really think about collectively, is how do we shift from being entitled to that of appreciation? Just like you're grateful for each other. You're appreciative. I'm appreciative when I'm not feeling well that Betsy picks up my slack, so to speak, and says, hey, I'll meet with so-and-so and I'll clear your calendar. That's being grateful. I could not say one word to Betsy and say, clear my calendar. Where's Janine at? So this week, I had something that came up in my life like many of you have in your life. Just was not going to be able to get it done at work that day, half a day. I really thought about just canceling the whole day. But guess what? I was meeting with type A Kathleen. So I took a deep breath with Kathleen. She didn't know this, so I'm going to reveal right here. And I realized that she is planned for that meeting knowing Kathleen. She's got her checks, and she's checking it twice, and she's going to let me know who's naughty or nice. So therefore, I'm going to value that time. So I said, Janine, can we reschedule the others, but let's keep Kathleen and a community member that I need to meet with. So during that conversation, she didn't tell Kathleen this, but yet she had conversation, and it actually helped Kathleen to do something differently, and actually was better for her to move forward to the next day. Again, I'm very thankful for that. And I hope it went both ways. But again, I could have had that entitlement mentality. Guess what? Move her to tomorrow, tell her to cancel her morning, because by my position, I could have done that. Just like you could with your people. But yet we wonder why sometimes we get the outcomes of some of that. Think about it. I just want you to think about it. So let's look at our results for a second quarter. So here's our pillars of performance. So again, the average limb score, about a 2.88 for the organization. Again, right here, people, we're still not where we need to be with our turnover rate. I know there's a lot of great work going on there. I know that some turnover is good, but also, we don't count the turnover now that's moving to GHS or Palmetto Health. We don't even count that anymore. Because actually, we're promoting some of that to get economies of scale and to integrate better. So that's not counted. That's outside of all that. So again, we're working there. One of the action items we realize sometimes our people move for pay. So we've done a recent market assessment of all of you. So all the management group has been, and all leadership has been reviewed by market. And so your supervisor will sit down with you and share that in the very near future. So that's been done. And actually, from a market perspective, it actually looked pretty good. We have 4 or 5 of you that are going to probably enjoy to hear some of our conversation. We also have 4 or 5 people in the room that probably are paid beyond their max for different reasons. And so therefore, guess what? We're not touching those that are being overpaid by market, but we are going to make some movement on those who are being paid just below their threshold. We're also doing at the same time all employees, and then we're going to prioritize that for the organization, like we said last time. But there's 3 areas that we're focusing on as priority. You're going to hear from Marianne in nursing, some things that nursing is getting ready to do here at Baptist Easley. So that will be one focus, specifically our CNAs. If you work in the physician enterprise, the POAs. So that, and then if you work in finance, you're looking at CBO finance. So we know that some of those areas will be looked at, and those will be the top 3 that we will look at. But we'll look at every employee, lottie-dottie, everybody. I also want to thank Liz, very thankful for this work you've done, Liz. A part of the assessment that has taken such a time is that we had to go through every employee's file and pull out all their experience. That was a part of the model to do reassessment. So again, Liz, I want to say thank you. I know that's been a ton of work and a ton of hours, and yes, and you can have off Saturday and Sunday next week, okay? So again, I want to say thank you again. I really appreciate it. I believe that we pay our people to market, and we're fair. And if we're not right, we will correct it. But realizing there's an impact, there is a consequence of that action. We have $500,000 coming down the pike with cuts from the feds. That's not including all the other managed care contracts, all these other type things. So again, we'll all get together and we will look at this collectively, okay, as leadership here. As quality, again, I want to thank the quality team as well as all of you. It takes everyone a part of this work. But again, that's a lot of work here, so that's green. When you look at our service pillar, so this is our patient experience. Again, on the inpatient, we're at a 3 of 8, so that's red. Our physician enterprise, that's green, 6 of 6, so kudos to you. Our emergency department, I'll tell you, that was at the second quarter, around the 50th. But from recent look, I believe both the ED and the inpatient has made a move upward. So I want to say thank you. A lot of action steps. Brian, I know you know the ED very well with Angie and Marianne, all of you. Again, majority of those transition changes happened around transition, going back to that sustainability around change. So again, finance, hitting that goal. I know it takes everyone, the focus, and you'll see more of that in the next few weeks as we're planning for budget. But again, it's good to see that movement in the right direction. But realize, we have things that hit us every day. We're running about $100,000 negative to budget just on health claims. That's significant.
100,000 on water damage.
100,000 on water damage. Again, take the message back. We have the money to correct that. We need to make sure we do a better job communicating on that issue. But again, a lot of work there. But I'm not going to talk much about that in this session. But I can tell you, we had some damage here about 10 or 12 years ago. And based on what transpired recently, again, that has caused a lot of problems with this breakage. So we have went from about $35,000 in cost damage because of that past experience. Damage has been about 70 more thousand. So again, things happen, and we'll get in the details maybe at another time. But so therefore, growth goal, increase new patients in the primary care. I know the physician enterprise, you're feeling some of that for sure. Again, this is something that we all control or be a part of. This is our internal movement, referrals, our physicians, our internal. So our goal is 77%, and we're at 71st. A lot of work has to happen here. So I would be asking the physician leaders, those that serve on the POC, they're very aware of this information. They get all this before you get it. And so again, it got kind of quiet in the room when we started talking about referrals. So I would ask each of you to ask those questions, ask them of your practice management, and let's all work together to see how do we make that shift? How do we make that change? And again, our community goal. Again, overall score, 2.88. Still, I believe mediocre. We can do better than that. And again, we will. I want to remind us, we talked about this last September, that merit will be based on achieving these three pillars. Well, you say, well, you know what, we're about halfway. Realizing finance is the trigger. That really drives that merit. So we'll get to the year end, and again, based on the audit, that'll be paid out after the audit. Now, some have asked in some of our team meetings with our employees, just having conversation, what about if we achieve everything but ER? Then here's my commitment to the employees. If we hit the finance, we're going to have a conversation about, do we still have an opportunity? Because the employees, I know many of them have worked very hard. And the financial picture has shifted over last year. So again, we stated if we achieve those three indicators, those three pillars, we would pay it out. But we did not say we would if we didn't. If it was like 75% or 25%. So we'll come back at the end of next quarter, see where we're at, but it'll be based on these three pillars of performance. So stay the course, stay focused. That's kind of our P&L there, unaudited there. So again, just a reflection of that pillar. You've seen this in the media, and I want to talk about the initiate. I've had folks ask the question is, why are we not a part of initiate? Well, we are a part of initiate. And so I want to just kind of reflect that. I think you understand that, but I want to make sure you have a slide to show the employees and have a conversation. So again, this Initiate Health Collaborative, primarily a joint purchasing of equipment, supplies, and services. So again, that has GHS, Palmetto Health, McLeod, MUSC, and Self Regional. So within Palmetto Health, they have other organizations within Palmetto Health, but it's listed just once. So being a part of both organizations, we are represented. Now look at the stretch of how these 5 organizations are looking across the state. Look at the next slide and look at the geography. Now think about that one. So here you have GHS Palmetto Health. Aren't you glad we're the love child? So here we are, right here. Then you got GHS, Oconee, then you got the other GHS, you got Self, Palmetto Health, and then you have MUSC. So look at that broad area of geography that really has come together. And what's neat about it is some of these organizations and some of the leaders, many of them have never even been able to get along. Chuck Beeman said something to me a few weeks ago. He said, do you know we are working more with GHS than we've ever worked? Mike Reardon said the same thing. You know what he contributes that to? All of you. Us, as a team. We have opened up a door, a gateway, a bridge to the two owners getting closer. Whether it's with Huron, whether it's with supply initiatives. And I want to say thank you to each of you. Make sure you thank your employees and connect this dot, because we're all working together just by your presence at the LDRs. You're meeting people that how many didn't know someone, or let me know, that's not a good question. How many of you did not know someone at the LDRs the first time you went? Okay, look at there, 7 or 8 people. That's amazing. 9. That's pretty remarkable. And now you know a lot more of your colleagues. Continue to search them out. But again, I want to say thank you. Both leaders really reflected that. But what a phenomenal task. They actually have sent out most recent RFP. I thought one of the RFPs was ironic was that of landscaping. That these bodies would get together and try to find landscaping that could be alike to save money. That's pretty remarkable. I didn't see security. I didn't see some other things that I would have looked at, but I thought it was unique of things they're looking at together to get economies of scale, to get really some dollars out, and to be more efficient and to optimize. Daily safety huddles. Man, I want to thank George. I want to thank all of you that are involved in as we're beginning to move to a daily safety huddle. Again, this will be during the week, 9 a.m. on weekdays. Again, at 9, I guess, can be concluded by 9:10. I would say most of the safety huddles were just 5 or 6 minutes. But I think what's unique is the outcomes and the relationships that's being built through those huddles. The typical agenda are issues the past 24 hours, a culture of safety as we're shifting to that of high reliability. That needs to become a part of our conversation, is how do we, again, we're not perfect, as you all know. None of us are perfect. But we're all reaching and searching and really moving to that perfection. Because when Dr. Helmrich and I really talk together about high reliability, to include all of you in conversation, our community, our partners, our physicians for the future, they want to be a part of your organization that's focused on high output, high optimization, really those things that keep our patients safe, and we are to be able to do that better than anyone else because of each of you and the team you have. That's what organizations and people desire. This community is saying, we have to have it. If we're going to support you, you got to be that, because we can go other places and we can get that. But guess what? I believe they can get it right here. Our data shows we can, and we are. I also want to thank Jody. I was sitting there trying to figure out how to incorporate this. I know Jody applied also with Lyle Jacks and some others around the grant for transitional care work. They just got notice this past week. My weeks are off, so maybe it's last week or maybe it's this week. I don't know. All I remember is she brought it to me one day and it says sign. And we did. And because of that, your great work, Cynthia, I know you were involved and others. What is about 175,000 first year, 150-something thousand next year, or vice versa. Again, to help with transitional care. That's going to be remarkable. And again, right here, thank you. 3 other hospitals in the state. And again, you're a part of that. And I just want to say thanks. I believe this really moves us forward with high reliability for our continuity of care in our community. New patient care model. All right, Heather, so pop on up here.
Hi, I'm Heather Seabrook. I'm the nurse manager over Med-Surg, and I'm going to be Marianne's voice today. We are looking at something that's coming very soon down the pike of changing the patient care delivery model on Med-Surg. We're trying to incorporate more of a team-based model that includes both nurses and CNAs. So there will be a team of nurses as well as CNAs that are assigned together and assigned a group of patients, and the care will be coordinated among that team for the unit. The reason why we're doing this is to improve patient care that's delivered at the bedside. That's very important to us. We want to make sure that the patient experience is key in everything that we do. The other thing is that we want to provide appropriate levels of support staff that can meet the needs of our patients. One of the biggest challenges and feedback that we hear from staff is support staff needs, and so we're really trying to address that. We want to improve the patient experience and outcomes of care, and then just improve the overall staff environment, the morale. We think that based on the literature that we've reviewed, based on the feedback that we have from staff, in an actual site visit that we actually got to do at Presbyterian that actually had this model, we feel like that this is a great advantage for med-surg to move to something more of a team-based. So nursing, Marianne and I are very, very excited about what's to come. I know that staff feel involved, and that is, to have their buy-in is key. So we're very excited about what's coming down the pike.
And again, I want to thank Marianne. I want to thank, it's been more than just, I know Marianne and Heather, I know Human Resources has been involved with that. This has significant implication. While those two slides, for the sake of time, they don't quite give that justice. And I'll tell you, it's huge impact on the patient experience, but also has financial implications to the organization, and the mix will significantly change for the future. And we will be a kind of a test site, like she stated. Our parent organizations will measure this. We'll share it. I'll be curious to see how do we move people from the nurse to the CNA and have everyone in this organization working at top of licensure. And this will be kind of a first step in that direction, is to get folks to work at top of licensure. When you think about corridor clutter, safety being at the foremount of all we do, paramount. Again, one of the Joint Commissions ranks number 4th as the most cited standards of hospitals. So as you walk throughout the organization, and I love the real rule of thumb here is if the item is not used within 30 minutes, it's clutter. Now we realize, I believe they call them WOWs today. I think historically they called them differently than WOWs. But again, I guess that's the PC word. But again, these are the computers on wheels. That's what they call them. And is that right?
Wireless on wheels.
Cows was the old word.
Wireless on wheels.
Oh, wireless on wheels. Yes. I could see the computer. But anyway, those are a part of the work environment. But we need to make sure that we keep that area around those free of clutter, our hallways free of clutter. You are to really, as leaders, go back, look in your storage closets, look in all the areas of your departments. We don't want any clutter. If it's not something, whether it's in the emergency department or the med-surg or administration, if we're not going to use it within the 6 months to a year, it either needs to be given away or destroyed. And if it's broke or cracked, you need to destroy it. If it's a disposition of assets, you need to see Kathleen or her team. But we don't want anything in our organization that becomes clutter bound. We're not hoarders, and I always remind myself, this is not my house. I can't find a cranny to cram everything in. So let's remember, less is best. Remove the clutter. Everybody go back, let's remove the clutter. A current system. Again, we are seeing some movement. I know Dale and April, you did some great work on making sure we all get the information. And now it's our job to partner with you to lead this effort. And so, again, I want to remind us, our employees, what is the current system? We still have employees that have not utilized the MIDAS system. We have management that still has not utilized the MIDAS system. Again, what is it? It's a standardized form to report any type of actual near-miss incident that may or may not cause harm. A few weeks ago, I met with the president, owner of the Greenville Drive. We're going to bring him back here. A few years we worked with him and did some near-miss work, and you saw it at some of the LDRs around the Good Catch. I remember when we did that program, we were heavily involved, and so I'm like, hey, come over to Pickens County. We need to work together. We want to grow your business, and we want to make sure we're taking care of our organization and our community to make sure we remove all process, harm, or potential harm. And we need your help. And so we're going to work with him. I think he'd be a great partner. Again, who can report? Any hospital employee. I'd take it further. If someone doesn't have access and they work here, they can tell you as a supervisor. We'll help them put it in. Again, it's not just for hospital employees. Why do I need to report occurrence? It allows us to identify, process issues, and find solutions. If we're truly on the journey to high reliability, we will embrace this. We will help your work out, Dale. And I know you and April will give us the trending and so forth, but it's our job, just like corporate compliance, it's our job to lay that out. Unidyne renovations. Again, Betsy was very gracious. This was not easy doing this way. I really don't prefer this method. But again, we wanted the dietary team to really give a big hoorah, so to speak, and it's all for you and your team. They want it to be so special. So June 1st, we'll open it, and we're excited about that. And we'll do some work outside. I know Brian's working now to make that outside environment very special. That will have a water feature. Hopefully, I'd love to have a labyrinth back there, a walk-around labyrinth. We need all the stress relief we can have. So I'd love to see you all out there walking around, meditating. We need it. I said don't put that slide in there, Betsy Bean. Sorry. Anyway, where's Beverly? She stepped out. So Beverly did a great job, just like many of you, with our March of Dimes work and our relay work. That was a very cold experience, and I'll just leave it at that. We're very committed to our community, and we're going to continue to have a lot of fun with this. I know from the March of Dimes perspective, I don't know the relay, but we're so close as a county, almost there to $150,000. And so we're very close. County historically has achieved around 90, so we're almost there. So we've got about 8,000 more, and we'll hit it. So again, I want to say thank you for that. Rewards. You know, sometimes I think, and again, I know most of you are part of rewards and recognition of your team, but I think sometimes that we don't, because of your humility, we don't share enough of the great things you're doing. We reward and recognize our team for outcomes. It's outcomes based. We want to hear thank you. Wouldn't you agree? But unfortunately, you want to make sure that when someone gets rewarded and recognized, it's with great outcomes, not just because it's nice, which is nice to say thank you. But I think you all get the importance of what that means. So we do a lot. We do. We have Doctor's Day drop in, and we want to make sure, and I need your help to make sure our employees understand that. If you don't feel like your employees are getting that recognition, you need to talk to Betsy, you need to talk to your supervisor, and let us really drill down for that. One of the things that I'm doing, I just want to share with you, about every week I will pick a different time and I'll walk into our Starbucks, and this is kind of one of my things that I'm doing as I should be doing, and I'll tell the Starbucks team, the next 5 people, the drink's on me. It's not a drink, but you know what I'm saying. And I'll tell you, we want that environment to be special for our employees. We want it to be special for you. We want that to be off stage. Now, those of you that work in the practice environment, we do have your team that come over, but I want to get out. We have some partners in the community that I've been working with, and how do we embrace that type of work with our community members? So again, those are a little bit of resources, but I think we get a lot of bang for that. And again, but I want it to be based on their experience and not ours, so to speak. So again, I'll be working with you, some of the coffee vendors in the community, and again, there's a nice one in Liberty that I ate at the other day, and they would love to get involved with, you have to walk them right down the street. There's a great little shop there. It's not Starbucks, but they got coffee. We'll leave it at that, okay? All right. Also, National Healthcare Week. Did everybody get their gift? I hope you'll enjoy that gift. Nice gift. I want to thank the committee. Great work there. A folding chair, I tell you, not many organizations do that today. Another thing of appreciation. Again, all the other employees are partners. Again, get an umbrella, and then the medical staff receive this power charger, which is a pretty neat little deal, so they can always be found, and their batteries never run out. Again, we're going to continue to promote our Clemson Area Food Exchange. Again, they did make a change. They will deliver now to the Virginia's Coffee Shop. So I want to thank Betsy as well and others for that. So this is last Employee Connection Series number 6. Does the coffee shop hours meet your needs? 246 said yes. Current hours meet the needs. 31 wanted Saturday hours, and right now they're reviewing that option because that's beginning. Folks are missing that coffee on the weekend, and if we can get more of our community in, about 50% of those using the coffee shop are from the community. We want that to be even more. And so I know Betsy and Alex, she's not here, but they're looking at that. The current system, look at this one. 174 had completed an occurrence report. Now, I don't know what that was prior to that, but 137 had not completed an occurrence report, working to improve reporting. That takes each of one of us. So every time I hear a conversation about an issue, a complaint, a process issue, the first question, did you utilize the Midas system? I need each of your help there. If we want to improve process, we have to embrace Midas. Do you use the communication methods for information? Use the communication? Again, you can see that. So they're getting the communication and they're using it, except for the no's. Still their responsibility, though, to get information. You asked this question. This question came up overall last time. It says, regarding service, patient satisfaction scores in the ED, as well as other areas, but specifically in the ED, is each individual case examined to determine the cause of the patient's satisfaction or experience, or more importantly, dissatisfaction? I'm going to have Brian to come up here and answer this question. We probably could have Angie or Jennifer, and could ask them to answer it as well.
I don't even know if I need to answer that question when you know who the leadership is in the ED, with Mary Ann leading it and Angie and Jennifer. Of course, they look at every satisfaction score that comes back in. Now, we do have rules that we have to follow. If the person that's filling out the survey doesn't give us a name and they want to remain anonymous, then we can't drill down any farther, like making a telephone call to ask them to be more specific or to give us a little more to work with. However, if they provide a name and they say it's okay for us to call them, then we're on the phone with them, we're calling them, and we're finding out a process that may be broken and how we can fix that. And let me just tell you that not all of those processes are calls or bad calls. We also call on the good calls because we want to reward and recognize those that do a good job, and that's another way that we can do that. So to answer that question, we examine every instance. We look at it. I said that it was at the 67th percentile. They corrected me because those leaders are looking at it daily, and we know how volatile those scores are. They change daily, but they look at those daily. We also do a metrics that goes out every morning that gives us some data, and Angie and Jennifer, they put that up in several areas through the ED, so all the providers and the staff can look at ongoing statistics going on in the ED. So, okay.
Thanks, Brian. The next question was, we have lost several PCPs in the last few months. How are we replacing these physicians? I'm going to ask George to come up.
If you ask me what keeps me awake at night, it's access. And I think it's a frustration that all of y'all share too, that we just can't get patients in quickly enough into our primary care practice. We had somebody we were ready to sign at Liberty, and at the last moment he fairly unprofessionally just disappeared on us, and that really put us in a bind. Liberty is in such great need, so we're going to go ahead and do something that I don't like doing but is essential, and that's getting the locum tenens. We're going to have Dr. Towns here for about 4 months starting June 1st. And now if we have somebody to replace her before then, we'll probably move her someplace else, but we're going to commit to getting her here immediately. We're engaging a search firm, Medicus, which is one of the more aggressive firms, and they've been very successful in placing very good physicians. Doesn't come cheap, but we're hoping that we're going to find some of the right people. We've got some high priorities. We're going to get a permanent placement at Liberty. We need at least one doc at Medical Center, and we're probably going to hire a total of 5 primary care. So we could have 5 additional primary care docs by this October. We're also, Donna Marling, who is currently at Genesis, is going to move over and be really the centerpiece for a new model that we're going to put in where cardiac rehab is now, and it's going to be a combination of urgent care, with the first priority being our employees that are here at work. Next priority are those employees that are not working but on our plan, and then dependents can also come here. We're going to have some continuity patients because Donna will bring some of her patients along. And frankly, there are going to be some people that say, look, I can come in at 7 o'clock at night and get a physical. I don't have to miss work and I don't have to wait. So there will be some chronic patients. We're going to marry employee health with that area too. So now getting a flu shot or getting a PPD or a pre-employment physical is going to be much easier. We think this is going to be a huge win. There are very few days to go by that we haven't figured out something we're going to be able to do with what currently is Genesis. We keep speaking about Genesis, but it'll be something else. Betsy came up with the BE First name. I don't know. We'll probably end up having a contest, but we're going to significantly improve access over the next 4 to 5 months. Once the Genesis project is up and running in the hospital, that'll be 256 appointments a week that we don't have right now. Now some of those are filled because she has chronic patients, but that's a lot of slots. So I think you're going to see a big difference. Do I wish it was last October? Absolutely. Do I wish it was next month? Absolutely. But we're making some big strides that you're going to see some big changes hopefully fairly soon.
Appreciate it. Next question that came up, and we wanted to answer it, is whatever happened with the cancer center? And again, I recall early on, when I came here, looking at all the documentation and look about all the things that happened around wellness, conversation around the cancer center. And right after we had met with GHS last year, my dates get off just a bit, but we had made a decision to go down the path of cancer prevention and wellness. We realized there had been a study done for the wellness center. And again, I won't discuss much about that, but we realized that based on the movement in the market with the LINAC, which is a linear accelerator, and so we had went to DHEC, did all that work, and then the decision was made to kind of pause. And then right when we come back to strategy to say, hey, let's begin to plan an MMOB, a cancer center prevention wellness, GHS and Palmetto Health, and primarily in the conversation of integration and making sure we optimize every opportunity with our current operation. So GHS came in, we actually looked at, I know Brian, he stepped out, but we actually looked with facilities, the facilities folks, to really see, could we look at, because the lease came up on their practice, and could we bring that part of the cancer center into the hospital? Well, we couldn't find, oh, there you are, Brian. I didn't even see you there, so thank you. But we had looked at that potential opportunity. We were unable to find any space within the organization that met their need. So we went back and GHS asked, could we wait? We brought it back to the board to say, looking at a group called Chartis to really look at the market, look at the future, because the market had shifted and changed. And so the Chartis work has been accomplished. So we met and discussed that work. Now we get into 2015, and then the board, we said, what are we going to do with cancer possibility and prevention and wellness? The board still understands that cancer care and cancer prevention is a vital issue in Pickens County. But whether we build a building or we do a prevention program or whether we do an MMOB or whether we do, you name it, needs a strategy behind it as an organization. So we made a decision to pause. And then once we get through the strategic planning work, that information will come up through that discussion, and we will put finally a decision. We will either go forward or we will not. We've already told the foundation, I know at least twice in the past, that we were going down this path. I'm not doing that again. We're going to get concrete information, but it goes back to healthcare and how healthcare, whether I like it or whether maybe some of you like it, healthcare shifts and changes daily. And the needs change daily. We know that we have a great need for oncology care in Pickens County. But what that looks like for the future, I'm not quite sure at this point. But we will have a decision through the strategic plan, and then we will announce it to the organization. But we're not going to get the cart before the horse again. And that's how and I know the employees will hear that, and I need you to help articulate that. And that's the real truth. It was disappointing, but it's the real truth at that moment. And that's where we're going. Will our IT be GHS based rather than Palmetto Health? Great question. We made a decision that a few years ago during our joint venture, part of the allocation, that part of that would be with Palmetto Health. We're currently undergoing with PwC and GHS a EPIC assessment. Now, The EPIC assessment's probably about in its 8th or 10th week. I spoke to Rich Rogers last night, just knowing that this was coming up today, to see if he had any update on the final, and they're not through. Once they get finished with that, I will bring that information back to the board, and I'll share the information with the board. We are going through a discovery phase, and once that's accomplished, we'll share, and then based on that outcome of the board and their direction and their decision, and then we'll announce it to the system. So again, currently we're with Palmetto Health and Cerner. We're with Ambulatory Power Works. That's what we're doing now, and we'll stay on that path to further notice. And so again, we are doing EPIC discovery. So again, not having information sometime, or the right information, is important. I want the employees to all know that's where we're at. And so I need you to make sure you can articulate that as well. And then if you have questions, just let me know, okay? Again, mind you, please communicate. I get probably 4 or 5 a day here. I'm sorry, I took it off. But again, the CO Connect, I want to make sure that we still have an open door back to my office and back to the employees. And then remind you that this environment is never an environment for managing leaders down. I'm not going to allow our team to circumvent the management group, ever. And we'll never do that. It's always about the patient and the patient experience. Let's not forget that.